Welcome to video 13. So, in our last chat, we really established the vestibular nuclei as this incredible multisensory hub. But, that brings up a pretty big question. How does it actually do all that without missing a beat? Today, we're going to go under the hood and look at the amazing cellular machinery that gives this system its remarkable precision.
Okay, let's just start with this core question, because it's pretty wild. For you and I to stabilize our gaze, even during the simplest head movements, the neurons on our vestibular nuclei have to fire at this insane rate. We're talking over 100 times a second. So how on earth is that even possible? What's the secret sauce that lets them keep up that pace without ever failing?
Well, the answer isn't just about the signals coming in, but it's actually built into the design of the neuron itself. To get it, we really need to look at its intrinsic properties, the specialized ion channels that basically act as the cell's own high-performance engine.
Now, a huge part of this engine is a special kind of sodium channel called Nav1.6. You see, most sodium channels just open and then switch off. But this one, it does something really cool. It creates what's known as a resurgent current. You can almost think of it like a cellular spark plug. Just as the neuron is resetting, this channel pops back open for just a millisecond, giving the membrane a little push to fire again. It's what guarantees that perfect timing, spike after spike.
Okay, this is where the system gets really clever. It doesn't just rely on go signals to encode movement. In a pretty cool twist, it actually uses the release of a stop signal, or inhibition, as an active, meaningful signal to sharpen up its timing. This happens through a process called post-inhibitory rebound, or PIR. Here's how it works. Say a neuron gets an inhibitory, or stop signal from the other side of the brain while your head is turning. Then, as your head motion changes, that inhibition gets released. And that release acts like a trigger, activating specific channels that cause a powerful rebound burst of firing. This burst is what makes the whole push-pull system incredibly sharp and responsive to super fast changes in direction.
And here is the big clinical implication of all this. When these tiny precision mechanisms fail, it's not just that the signal gets weaker. What really happens is the timing, the temporal code, completely breaks down. And this loss of timing is just as devastating for gaze stability as losing the signal itself. It really helps explain why some of our patients have such severe dynamic symptoms, even when their peripheral tests look relatively okay.
So how does knowing all this cell-level detail actually help us with the drugs we use? Well, it means we have to kind of shift our thinking. We need to start seeing medications not just as blunt instruments for suppressing symptoms, but as really sophisticated tools that can tune these very circuits.
This image really shows you the complex chemical landscape we're dealing with in the vestibular nuclei. I mean, it's a total mosaic of signals, right? You've got your fast go signals from glutamate, your fast stop signals from GABA and glycine that shape the push-pull dynamics, and then you have these slower modulatory inputs like histamine, which act more like a dimmer switch, just adjusting the overall excitability of the entire network. Now, even within that go system, the two main players have totally different jobs, and it all comes down to their speed. The super-fast AMPA receptors, they're built for those rapid, millisecond-quick adjustments we need for our gaze reflex. But in contrast, the slower NMDA receptors, they're designed to sustain activity over longer periods of time, which is absolutely crucial for functions like velocity storage.
The inhibitory and modulatory systems are really like the fine-tuning knobs. So take the GABA-B receptor. It's a slower-acting receptor. When a drug like baclofen hits it, it specifically turns down the velocity storage integrator. We can actually measure this in the clinic as a shorter VOR time constant. And it's a similar story with the histamine H3 receptors, which are targeted by beta-histine. They link the system's excitability to our level of arousal, giving us a lever to potentially influence central compensation.
All right, so let's tie this all together now. Let's connect these molecular details, these receptor speeds, directly to what we see in the clinic, to the real-world effects of the medications we prescribe. This table really pulls it all together. The main message here is that the speed of a receptor system predicts its function. You can see it right here. The fast AMPA receptors handle the lightning-quick VOR arc. The slow NMDA receptors take care of sustained integration. And then you've got these even slower modulatory systems like GABA-B and histamine H3 that act as our tuning knobs, letting us adjust specific things like the velocity storage time constant with baclofen, or maybe even the rate of compensation with beta-histine.
So, to wrap things up, let's just make sure we've locked in the three most critical takeaways from this whole discussion. First, that incredible firing precision we talked about is no accident. It's engineered by specific cellular tools like resurgent currents and post-inhibitory rebound. Second, remember that receptor speed is perfectly matched to its function, fast for reflexes, slow for integration. And third, all this knowledge opens the door to mechanism-based pharmacology, where we can actually use drugs to precisely tune specific circuit parameters.
And this leaves us with a really exciting thought for the future. If we can start thinking of pharmacology less like a sledgehammer and more like a set of precise tuning forks, what new therapies could we design? I mean, could we one day create drugs that specifically fine-tune things like sensory weighting or even the rates of adaptation? It's a really powerful idea to think about. We have connected VN firing precision in neurochemistry to clinical drug effects. Join me in video 14, Vestibular Reflex Systems, VOR, VCR, VSR, and Autonomic Output, where we cover the full vestibular motor output family and show how VHIT, headshake, CVEMP, and posturography each probe a different part.
Thank you for listening. To explore more on dizziness, vertigo, and imbalance, and to access clinician and patient resources, visit AustralianDizzinessClinics.com. Please subscribe and leave a rating.